Your legs can reveal hidden health problems if you know what to look for. Right now, as you're watching this video, your legs might be sending you warning signals about serious health conditions that you're missing. Today, I'm going to share 5 critical warning signs in your legs that you should never ignore, because they might point to something that needs immediate medical attention. Some of these signs seem so common that most people brush them off as just getting older, but that could be a dangerous mistake. By the end of this video, you'll know exactly what to watch for and when it's time to pick up the phone and call your doctor. This information could literally save your life or prevent serious complications down the road. Before we dive into the specific warning signs, let me explain why your legs are like an early warning system for your entire body. Your legs are the farthest point from your heart, which means they're often the first place where circulation problems show up. Think of your legs as the canaries in the coal mine. When blood flow starts to decline anywhere in your body, your legs feel it first. This is actually good news because it gives us a chance for early detection. When we catch circulation problems, heart issues, or diabetes complications early through leg symptoms, we can often prevent them from becoming life-threatening. Your legs also contain some of the longest nerves in your body, running all the way from your spine down to your toes. When these nerves start having problems, whether from diabetes, vitamin deficiencies, or other conditions, your legs will tell you about it before it affects other parts of your body. The key is knowing the difference between normal age-related changes and warning signs that need medical attention. A little stiffness in the morning, that's probably normal. But persistent swelling that doesn't go away, that's your body waving a red flag. Early detection equals safer, stronger, longer mobility. The sooner we identify problems, the more options we have to treat them effectively. So let's start with our first critical warning sign. 1. Persistent swelling. Warning sign number 1 is persistent swelling in your legs, ankles, or feet, and this is probably the most misunderstood symptom on our list today. Let me be clear about what we're not talking about. If your ankles swell up after a long day of standing, or if you notice some puffiness after a salty meal, that's usually normal. What we're concerned about is swelling that doesn't go away. Here's what to watch for. Swelling that's still there when you wake up in the morning, swelling that gets worse throughout the day and doesn't improve with rest, or swelling that's only affecting one leg. This type of persistent swelling can indicate several serious conditions. It might be a sign of heart failure, where your heart isn't pumping blood effectively, causing fluid to back up in your legs. It could indicate kidney problems, where your body isn't properly filtering fluids. Or it might point to serious vein problems, including dangerous blood clots. One-sided swelling is particularly concerning because it often indicates a blocked vein or blood clot in that specific leg. This can be life-threatening if the clot travels to your lungs. Here's a simple test you can do right now. Press your finger firmly into the swollen area for about 10 seconds, then release. If you see a dent that stays there for more than a few seconds, we call this pitting edema. This is a sign that you need medical evaluation. Also pay attention to how the swelling feels. If the swollen area is warm, red, or tender to touch, especially if it's only on one side, this could indicate a blood clot, and you should seek immediate medical attention. Don't wait and hope it goes away on its own. Persistent swelling is your body's way of telling you that something in your circulation system isn't working properly. And the sooner you address it, the better your outcomes will be. 2. Constant cold feet or legs. Warning sign number 2 is something that many people dismiss as just poor circulation, but it can actually be a sign of peripheral artery disease or serious diabetes complications. I'm not talking about feeling chilly when it's cold outside or having cold feet when you first get into bed. We're talking about feet and legs that feel cold to the touch, even in warm environments, or when the rest of your body feels comfortable. This happens because your arteries, the blood vessels that carry oxygen-rich blood to your legs, are becoming narrowed or blocked. When your leg muscles and tissues aren't getting enough blood flow, they literally become colder than the rest of your body. Peripheral artery disease, or PAD, affects millions of people, especially those over 60, and it significantly increases your risk of heart attack and stroke. Why? Because if the arteries in your legs are becoming blocked, the arteries around your heart are likely having similar problems. Here's what to look for. Feet or lower legs that feel cold to touch. Skin on your legs that looks pale or has a bluish tint. Or if you notice that your leg hair is disappearing. Yes, hair loss on your legs can be a sign of poor circulation. People with diabetes need to be especially vigilant about this warning sign. Diabetes can damage both your blood vessels and your nerves, creating a double problem. Poor circulation means wounds heal slowly, and nerve damage means you might not notice injuries. This combination can lead to serious infections or even amputation if not caught early. Don't ignore constantly cold legs, especially if you also notice that small cuts or scrapes on your feet take a long time to heal. This combination of symptoms strongly suggests that your legs aren't getting the blood flow they need. The good news is that when caught early, there are many effective treatments for circulation problems, from lifestyle changes to medications to minor procedures that can restore blood flow. 3. Numbness or tingling. Warning sign number 3 is numbness or tingling in your legs or feet, and this is one that people often ignore for way too long. We've all experienced our foot falling asleep after sitting in an awkward position. That temporary pins and needles sensation is normal. But what we're talking about is different. This is numbness or tingling that happens regularly, lasts for extended periods, or is getting progressively worse. This type of nerve-related symptom can indicate several serious conditions. The most common is diabetic neuropathy, where high blood sugar levels over time damage the nerves in your legs and feet. But it can also be caused by vitamin B12 deficiency, certain medications, autoimmune conditions, or even spinal problems. Here's what makes this particularly dangerous. When you lose sensation in your feet, you lose one of your body's most important safety mechanisms. You might step on something sharp and not realize it. You might develop a blister from ill-fitting shoes and not notice until it becomes infected. I've seen too many cases where people ignored numbness in their feet, developed a small wound they couldn't feel, and ended up with serious infections that could have been easily prevented. Pay attention to these specific symptoms. Burning or shooting pains in your legs, especially at night. Feeling like you're wearing socks or gloves when you're not. Difficulty feeling the difference between hot and cold with your feet. Or balance problems that seem to be getting worse. The location matters too. Numbness that starts in your toes and gradually moves up your foot and leg often indicates peripheral neuropathy. Numbness that follows specific patterns might indicate pinched nerves in your back. Don't wait for numbness to get worse. The earlier nerve problems are diagnosed and treated, the better chance we have of preventing permanent damage. Many causes of numbness are treatable, but only if we catch them before the nerve damage becomes irreversible. 4. Unexplained leg pain at rest or while walking. Warning sign number 4 is leg pain that occurs either at rest or during normal activities like walking. And the timing of this pain can tell us a lot about what might be wrong. First, let's talk about pain that occurs while walking. This is called claudication, and it's often the first sign of peripheral artery disease. The pain typically starts in your calf muscles after walking a certain distance, gets worse if you continue walking, and goes away when you rest. Think of it like angina, but in your legs instead of your chest. Just as chest pain during exertion can indicate blocked arteries around your heart, leg pain during walking can indicate blocked arteries in your legs. And here's the scary part. People with PAD have a significantly higher risk of heart attack and stroke. The classic pattern is this. You can walk a certain distance, maybe 2 blocks, before your calves start cramping or aching. You have to stop and rest for the pain to go away. Over time, that distance gets shorter and shorter. Now let's talk about pain at rest, especially pain that's worse at night or when you're lying down. This is often a sign of more advanced circulation problems. When your circulation is so poor that your legs hurt even when you're not using them, this is a medical emergency. This type of pain often gets better when you hang your legs over the side of the bed or get up and walk around, because gravity helps pull blood down to your feet. If you find yourself sleeping in a chair because lying flat makes your leg pain worse, you need to see a doctor immediately. Don't confuse this with normal muscle soreness after exercise or the general aches and pains that come with aging. We're talking about pain that follows predictable patterns related to activity and rest, and pain that seems to be getting progressively worse over time. Also watch for pain that's combined with other symptoms we've discussed: pain plus coldness, pain plus swelling, or pain plus skin changes. These combinations often indicate serious circulation problems that need immediate medical attention. 5. Slow healing wounds or skin changes. Our 5th and final warning sign involves changes to your skin and how well wounds heal on your legs and feet. And this one can be the most dangerous, because it often indicates multiple problems happening at once. When circulation to your legs is poor, your skin doesn't get the oxygen and nutrients it needs to stay healthy and repair itself. This shows up in several ways that you need to watch for. First, pay attention to how quickly cuts, scrapes, or bruises heal. A small cut that takes weeks to heal, or that seems to get worse instead of better, is a red flag for circulation problems. This is especially important for people with diabetes because poor circulation combined with high blood sugar creates the perfect storm for serious infections. Look for these skin changes. Skin that's becoming thin and shiny, almost translucent. Skin that's changing color, becoming pale, bluish, or developing a reddish-brown discoloration. Skin that feels unusually cool to the touch, or areas where leg hair is disappearing. These changes happen because your skin isn't getting adequate blood flow. The shiny appearance happens because poor circulation causes the skin to thin out. The color changes occur because tissues aren't getting enough oxygen-rich blood. Here's something that many people don't realize. Even minor injuries can become major problems when circulation is poor. A small blister from new shoes, a tiny cut from shaving, or a minor bump can turn into a serious wound that won't heal. Watch for any sore, ulcer, or wound on your legs or feet that doesn't seem to be healing normally. These often start small but can quickly become infected when your body's natural healing processes aren't working properly. Also be alert for any unusual growths, persistent itching that doesn't respond to treatment, or areas of skin that feel different from the surrounding tissue. The key message here is that your skin is a window into your overall health. When circulation problems are affecting how your skin looks and heals, they're likely affecting other parts of your body too. Now, I want to be clear about something important. Not every ache, pain, or bit of swelling is dangerous. Our bodies do change as we age, and some discomfort is normal. But if you're experiencing any of these warning signs consistently, or if you notice them getting worse over time, please don't wait to see your doctor. Early intervention can prevent minor problems from becoming major health crises. Here's when you should make an appointment within the next few days. Persistent swelling that doesn't improve with rest, numbness, or tingling that's interfering with your daily activities, leg pain that limits how far you can walk, or any wound that isn't healing normally. And here's when you should seek immediate medical attention. A sudden onset of severe leg pain, especially with swelling and warmth. Any leg or foot that becomes suddenly cold and pale, chest pain combined with leg symptoms, or any wound that shows signs of infection, like red streaking, pus, or fever. Remember, your doctor would much rather see you for something that turns out to be minor than miss something that could have been easily treated if caught early. Don't let embarrassment or fear prevent you from seeking care. These symptoms are common, they're treatable, and addressing them early gives you the best possible outcomes. Let's quickly recap those 5 critical warning signs. Persistent swelling that doesn't go away with rest, constantly cold feet or legs, numbness or tingling that's getting worse, unexplained leg pain during activity or at rest, and slow healing wounds or skin changes. Your legs are constantly communicating with you about your overall health. Don't ignore these important signals. They could be the early warning system that helps you prevent serious complications. I want you to do 2 things after watching this video. First, take a moment to honestly assess whether you've been experiencing any of these warning signs. If you have, make that doctor's appointment. Second, share this information with someone you care about. Maybe it's a spouse, a friend, or a family member who needs to hear this message. Knowledge saves lives, but only when it's shared and acted upon. Don't let another day go by, ignoring what your legs are trying to tell you. Subscribe for more health information that could make a real difference in your life. And remember, your health is worth paying attention to.